There we go. So I have a Kahoot prepared that we can do together to review and kind of talk through, um, test taking a little bit and obviously the concepts too. But I wanted to see if y'all had anything in particular you wanted to review first, or anything you maybe had questions about or struggling with or wanted to brush up on before we jump into that.
I do have a question, because I was reviewing earlier this morning, and do we have to know how to convert like milliliters to calories for like the milk for babies? Because I was stuck with that formula.
Okay. Yeah, so you might, but it's going to give you all of the pieces of information. So even if you don't memorize a formula, you could hopefully get from point A to point B. If you I might have to pull up an example, but for
Okay.
instance, if it says that the baby's taking formula and the formula is 20 kilocalories per milliliter, I
I
think
think it's
it's
per ounce. I think it was per ounce. I'm trying to remember because I was trying to look up like questions in regards to that. I was Googling it. But
Mhm.
it was like 28 calories dash ounces over like a certain period of time.
Yeah. So what you might see, you could see any range of that, yes. So right, so it'll give you like the baby's frequency that it's taking feedings. It'll give you the calorie per ounce, if that's what it is. Let me see. Um see if I can just find something, but and then you might have to, if you struggle with the formula, you might have to just kind of think logically through each step.
Okay.
Where it says, okay, I have this many ounces, and you'll want to make sure that you know how many milliliters are in an ounce, in a tablespoon, in a teaspoon, that kind of thing.
Mhm.
Be able to convert those.
Convergence. Mhm.
Yeah, and then because you might have to figure out how many milliliters that baby's getting over, say, 8 hours or 12 hours, and then
Okay.
multiply that by the number of calories, right? Um, let's see if I can find kind of a question. Yeah. It's hard to find legitimate questions sometimes. And, we don't really want you on any of those sites that might have some posted. So
Yeah.
like, I'm not going to bring you to those,
Yeah.
but
No, I was just using like the images because I Googled like how to
yeah.
convert this, and then I was doing it off of, because on the images for Google, they gave you like scenarios, and it shows you like the bottle of the milk for the baby, and it
Mhm.
gave like different ounces on there. So I was kind of like using those to try to figure out like, okay, how would I convert this, or what would I have to look for?
Yeah, I think I'm looking at one of those now. Which again, I hate to like kind of post it without vetting it really first. So I might,
Mhm.
I if I can find something good, I might post it in the chat so y'all can like click on it or whatever. But
Okay,
I would
perfect.
say look at the information. This goes for any question, right? Usually if you know the conversion factors, you can get to the answer, even if you don't have the exact formula memorized or whatever, because you can go logically like, okay, here's the information that I have, right? I have this number of calories, this number of ounces, and then this period of time, and then just kind of figure out each piece, and then, you know, go to the next and the next. And that should still get you to the right answer, even if it's,
Okay,
memorizing the formula exactly.
okay.
So hopefully that will help you enough. And yeah, I would again just kind of brush up on your conversions and everything. But yeah, good question. Anybody else have anything specific you want to talk about before we jump into the review Kahoot? I'm gonna go ahead and get it pulled up while y'all are thinking about it or posting about it. I thought I had it queued up and it's went off of it, but it's right here. All right. Sorry. Like I said, I thought I had it all queued up for you. Okay, I'm gonna start. And I'll copy the link so y'all can pull it up, and I'll share my screen also so you can scan it if you want, whatever way is easiest for you. Okay, I'll turn the sound off. All right, got Marcia. Tara, who's your teacher?
Mine's McBride.
Okay, yeah. And then just kind of FYI or whatever, these Kahoots are man-made. So of course they're not like a perfect scenario. Sometimes you might come up with a question that you either don't have enough time to finish or it's just kind of you know, two answers seem equally good choices. So if you come up with that, you know, we'll just talk through it and it's still a good opportunity to learn. Are the rest of you going to be able to join the Kahoot, or should I just keep going? I think you should be able to join with that link too if it's
Yeah, it's telling me to make an account, so I'm trying to do that now.
oh, okay.
I'm doing that too.
Okay. Have you not done a Kahoot before with any of your other classes then? Sorry about that.
No, we did, but I think we just had to like, it never gave me like to create an account. It
Yeah.
just,
I don't know why it is now.
yeah, that was just weird. We would just always just scan it or just put our names. That's it. So, or
Okay.
enter the PIN, which is that would have been that, but I don't know why it's doing it now.
Okay. All right. Well, it looks like everybody's joined, so let's jump in. Or actually, there's one that may not have. If you need me to go back or something, let me know. All right. The nurse is performing an assessment on a 38-week client and notes that the fetal heart tones are 174 beats per minute. What is the priority action? Document the finding, notify the obstetrician, check the mother's heart rate, tell the client that the fetal heart rate is normal. All right. So in this case, this is the answer. Notify the obstetrician. What is the normal range for fetal heart tones that we would expect?
110 to 160.
Good. So 174 it's significantly high. If that's the baseline that we're seeing on a fetal heart rate tracing. And that would be something we'd want to notify the physician about. So what's one of the reasons that the heart rate might be high? Anybody know that from your studies or lectures?
Maybe the position of the baby.
Not usually. Usually the position will only affect if the baby's like laying on the cord or something, then you might see a deceleration, but wouldn't normally expect to see an elevated heart rate for that reason. The first thing we normally think of is infection. We might have an infection starting, and it's really getting things heated up in there, and the baby's heart rate is going higher. Okay. We'll leave it at that. Any questions about that? Okay. That one was pretty straightforward. I don't have any. So, never mind. Let me keep going. The nurse is asked to explain the characteristics of the amniotic fluid. Select all that apply. So, amniotic fluid allows for fetal movement, maintains the body temperature of the fetus, surrounds, cushions, and protects the fetus, provides exchange of nutrients and waste between the mother and the fetus. Okay, so good job. So all three of these are correct, and nobody chose the distractor here, which is good. What is this one referring to? The green one?
The placenta.
Good. So yes, the amniotic fluid does allow for fetal movement, helps maintain the body temperature of the baby, and surrounds, cushions, and protects the fetus. So good. I'm going.
It looks like there's a couple messages in the chat. So I know Tara said she can't see the
Okay. See the answers on them. Yeah, thank you.
I can't see the answers either. I see it's showing me blank on my screen. I can see where you're reading a question, but I can't see how to answer it.
I'm sharing my screen, right? Can you see my screen on the Zoom? Or it's not, is it because you're on the same device, maybe? I'll read the color to you when I read the answer choices, and we'll just see if that helps. Either way, hopefully it's helping you kind of hear and think through some of the rationale. And then I saw, Marcia, you said cord compression and late decel up there from a couple questions ago. Just a very brief review of that. Cord compression, who knows what type of decel you would see with a cord compression?
variable.
Good. Variable decel with cord compression. It looks like a sharp V, or if it's a severe one, it might look more like a U. And then late decelerations, you can go back and review, your lectures and the book and things for that. But what are a couple of the buzzwords or the things that a late deceleration is showing us, and what we need to be aware of with a late deceleration?
Placenta insufficiency.
Good. So uteroplacental insufficiency is kind of that big buzzword, and that's what the late decel is showing, meaning there's not enough blood supply getting to the baby through the placenta. A lot of times that's because of a drop in blood pressure. It could also be because there's a problem with the placenta. Sometimes it's from calcifications or like damage to the placenta from long-term high blood pressure issues in gestational hypertension or preeclampsia. And then it could be like a more, I'm trying to think the word, but like a current immediate change in the placenta might be you're beginning to see a placental abruption where the placenta is separating from the uterine wall. So either way, late decels are very concerning, and we don't just sit and watch those, we act on it. What's the very first action we're gonna do in the case of a late deceleration?
Change my position.
Change your position, good. That's usually, it's always lateral. Left lateral is kind of like the gold standard. But of course, if she's already on her left side, a lot of times we'll switch her to her right side. So turn her on her side. Usually a test is going to tell you to turn her on her left side. Sometimes the question will say, you've already turned her to her left side. What do you do next? So there's other interventions to do, and we do all the nursing interventions that we can do very quickly, which is on that VEAL-CHOP acronym. The VEAL-CHOP, the one with the extra one, VEAL-CHOP mine or whatever. So we're gonna do all those interventions and then call the doctor. Okay. Ivana, our exam is Wednesday during class, yes, but other people have class at different times. Okay, let's go on to the next question. Which purposes of placental functioning should the nurse include in a prenatal class? Select all that apply. Red one is it cushions and protects the baby. Blue one is it is the way the baby gets food and oxygen. This is about the placenta now. Yellow one is it prevents all antibodies and viruses from passing to the baby. And the green one is provides exchange of nutrients and waste between the mother and the fetus. Okay. So for this one, the correct answers were the blue and green. It is the way the baby gets food and oxygen, and it provides exchange of nutrients and waste. It does not cushion and protect the baby, particularly. That was about amniotic fluid, right? And it doesn't prevent all antibodies and viruses from passing to the baby. It does allow most things can pass through the placenta to the baby. Antibodies and even viruses and things. So it doesn't filter those out. Okay. Good. The nurse is providing instruction to a client who is scheduled for amniocentesis. What should the nurse provide? Red, strict bed rest is required after the procedure. Blue, an informed consent needs to be signed before the procedure. Yellow, hospitalization is necessary for 24 hours after the procedure. You all answered very quickly. Good. Yeah, so it's an outpatient thing. Bed rest isn't required, but a consent is because it does come with some risks, right? Okay. Moving right along. A client states her last normal menstrual period began October 19th, 2020. Using Nagel's rule, what is the EDD? All right, so October 19th, 2020. Using that rule, come up with the due date, and the choices are July 12th, 2021 is the red choice. Yeah, that just took too long. Sorry. I was trying to give you time to calculate it, and it takes a long time. So the answer is July 26th, 2021. Who can talk us through how we came to that? How do we figure that out?
We do, you go back 3 months and then you add 7 days and then you add a year.
Yes, if it's your LMP is, yeah, and Marcia put it in there, so thank you. If your LMP is after March, then it's going to bump you over to the next year, right? If your LMP is January, February, or March, then your due date would be in like October, November, December, right? So
Right.
just be aware of that. But yeah, good, because you caught it. And a lot of times questions will try to throw you off by putting the same year, and kind of could be confusing there, right? It'll list that as a choice, so you just pay close attention. So yes, counted backwards 3 months, added 7 days, and then went to the next year. Good. The nurse suspects umbilical cord compression if which is noted on the external monitor tracing during a contraction. Red, variability. Blue, accelerations. Yellow, early decelerations, or green, variable decelerations. So umbilical cord compression. Okay, so yeah, this goes back to our veal chop, and it's cord compression makes you think of variable decelerations because basically the cord is getting pinched and it's like a sharp drop and a sharp return to baseline in that case. Variability, remember, is how squiggly the line is, and that is going to show us how well oxygenated the baby is at that moment of time. So if variability is getting too flat, it's getting less than 6 beats per minute. So that like 0 to 5, that's minimal variability. And sometimes the baby's just going through a sleep cycle. And it's okay. We wait about 20 minutes and see what happens or try to wake the baby up. But if it continues, or especially if it goes to absent variability, then it's something that we want to look at closely. And then accelerations. Remember, you have your baseline and accelerations go up above the baseline, and that's a reassuring sign. That's something that we want to see. What is the test called when we put a patient on the monitor and we're watching the tracing for at least 20 minutes? What is that called?
Fetal heart.
Say it again. With fetal heart rate tracing?
It's a non-stress test.
Yes. So the actual test is called the non-stress test. You might see it on a test called the NST. We're basically just putting her on the monitor and watching. We're seeing if she's having contractions or any decelerations, seeing the status of the baby based on the baby's heart rate, right? So what are we looking for? If it's a good result, what is the term? It's what kind of stress test or kind of tracing? Anybody know that one?
Are you just looking for like a positive tracing?
That
Is
is
it not non-reactive?
yes. So good. So reactive and non-reactive. And you would say if it's non-reactive, then it would be like non-reassuring fetal heart tones. Okay. So what makes an NST reactive?
Fetal heart rate more than like 2 minutes per. I know it's a certain amount of time. I'm not sure, but I know it's a certain amount of time per a certain amount of time to make it reactive.
Yes, you're on the right track. Marcia typed in 5 movements within 10 minutes, but that's a different test actually. That's the test, the kick count test. That doesn't involve tracing. That just involves the mom kind of getting still and paying attention to her. It's fine, Marcia. It's all in there. You're just trying to make the connections and everything. But yeah, so NST, you're on the right track. We do it for 20 minutes. And what do we want to see in those 20 minutes to make it reactive? Does anybody know? We want to see that the baseline is good. What's the baseline supposed to be? You said it earlier. So just brushing up on that again.
It's 2 accelerations per 15 minutes, I believe.
For 20 minutes, yeah.
For
So
20 minutes.
think of your 20-minute strip there. We want to see 2 accelerations in that time period. Good. So what is an acceleration? What counts? I'm looking for like the dimensions of it, right? So how long and how many beats above the baseline? Is it ringing any?
15, it's 15 by 50, it's 15 and 15.
Good, yeah. So 15 beats per minute above the baseline. So if our baseline is 110, then if we have the heart rate going up to at least 125 for 15 seconds, 2 times, then that's 2 accelerations in that 20-minute period. Okay. And then we would not want to see any decelerations in that time either, right? So those are the main things we're looking for. We're looking for moderate variability. We're looking for 2 accelerations and no decelerations. Okay. Good. The nurse notes the presence of an episodic accelerations on the electronic fetal monitor tracing. What is the most appropriate? Red, document the findings and tell the mother this indicates fetal well-being. Blue, notify the physician or nurse midwife of the findings. Yellow, take the vital signs and tell her bed rest is needed to conserve oxygen. Green, reposition the mother and check the monitor for fetal tracing changes. Okay. So episodic accelerations, that just means we're seeing episodes of accelerations in the tracing, and that is a good thing. Accelerations are always good. It's decelerations that would be concerning. Okay, so that's why red is the answer here, to just document the findings and tell her that that is a good sign. It indicates fetal well-being. Okay, any questions on that? Anybody have any specific questions on kind of fetal heart monitoring in general at this point?
No, I'm just clicking on it and I'm trying to get on it and it would not let me.
Yeah, that's okay. I mean, I know it's kind of imperfect. We're not judging. It's okay. Just get what you can out of it. After the attachment of the electronic fetal monitor, the initial nursing assessment is which of the following? Red, identifying the types of accelerations. Blue, determining the frequency of contractions. Yellow, assessing the baseline fetal heart rate. Green, determining the intensity of the contractions. So it's, what is the initial nursing assessment when you put her on the monitor? Okay, so yeah, the yellow, assessing the baseline fetal heart rate, is the answer. So anybody tell me why you think that's the case? Just explain why that's the right answer. Just answered it accidentally. Well, we're putting the baby on the monitor. That is definitely the first and most important thing we're concerned with is, how is this baby doing? And the way we know how the baby's doing is its heart rate. That's the only vital sign we really have to assess the baby in utero. So the heart rate is very important. So that's why that's the initial thing we're looking at as soon as we put on the monitor. And a seasoned nurse will put the baby on the monitor. They can tell within a few seconds whether it's in a normal range. And then within a couple of minutes, how's the variability looking? Do we have any decels so far? That kind of thing. And then it takes, several minutes, because even a mom in active labor is probably only contracting about every 5 minutes, maybe like 3 to 5 minutes when she's really far into it. So it takes several minutes for us to really be able to observe her contractions on the monitor. So the initial thing we're looking for is definitely the baby's heart rate. And that's just a really important basic vital sign for the baby. Look for clues too in your questions. If you notice, this says assessing the baseline fetal heart rate. Look for clues like that, because of course a baseline is like a starting point, right? And that's kind of what the question's asking too. So try to look for clues like that as well. The priority nursing intervention on the admission of a client in early active labor would be red, auscultating the fetal heart, blue, asking the client when she last ate, yellow, taking an obstetric history, green, ascertaining whether the membranes were ruptured. So the priority nursing.
Red.
Would you say, Deborah?
I said red.
Oh,
I
yeah.
can't click it. I can't. For
that's-
some reason, I can't click it, so I just say that.
No, that's good. I thought I only caught part of your word, and so I didn't get that you were saying red. But yes, good job. And yeah, you guys got that one. So, just like we just talked about, right? That is extremely important. It's the first thing we're concerned with. And it's really the first thing we do when we get a mom in triage, when we're beginning to assess her, even while we're asking her questions and things, we're putting her on the monitor because we want to see how the baby's doing too. We need to know very quickly whether we have an emergency on our hands. So, okay. After doing Leopold's maneuvers, the nurse determines that the fetus is in the ROP position, where to best Doppler the fetal heart tones. Red above the umbilicus at the midline, blue below the umbilicus on the right side, yellow above the umbilicus on the left side, green below the umbilicus near the left groin. I know we talked about this in our class. Good. So yeah, below the umbilicus on the right side. So ROP means the baby's back or the baby's occiput is what this term actually means. The baby's octopus occiput. Oh my gosh. Okay. Is on the mom's right side. Facing the mom's right side. And in the posterior position. But wherever the fetal back is, which is like the occiput, right? It's kind of in line with our spine, is where we're going to best hear the heart rate. And if the baby is vertex, head down, we would hear the heart tones below the umbilicus. And if we don't get heart tones below the umbilicus and we can only get them above the belly button, then we're concerned, maybe suspecting that the baby might be breech. I hope y'all got a good laugh out of me saying the baby's octopus. I can't talk tonight for some reason. Okay. The nurse observes the client's amniotic fluid and decides that it appears normal because it is red, clear and dark amber in color. Blue, clear, almost colorless and containing little white specks. Yellow, milky greenish yellow containing shreds of mucus. Green, cloudy greenish yellow and containing little white specks. That was kind of confusing because I was saying colors and all the answers had colors in them, but yeah, good job. So the answer is clear, almost colorless and containing little white specks, which is the vernix. Little bits of vernix maybe kind of floating around in there. We don't want it to be a particular color. If it's dark amber color, that might be blood tinged. And if it's green, what might cause it to be green?
Meconium.
Yes, good. Meconium. Meconium's not good to be floating around in there because it's baby poo and the baby is swallowing and literally breathing in and out or like taking in and out of its lungs this fluid, and that's not going to be very good for when the baby transitions to life outside the uterus, right? Why might amniotic fluid have a foul smell to it?
Infection.
Yep. Y'all got this. EFM, so electronic fetal monitoring, after rupture of membranes shows variable decelerations in the fetal heart rate. The nurse should: red, stop the oxytocin infusion; blue, prepare for immediate delivery; yellow, change the client's position. Green, take the client's blood pressure.
Yellow.
Okay, I think so. That's our best first option. Yes, good job. So, red would also be a choice if we had already changed her position. If she has oxytocin confusing, we would want to turn that off if she is having continual decelerations, but it's not necessarily something you have to do at first. Changing the client's position, especially for variable decels, can again get the baby off the cord, is the hope, right? So we're just trying to move things around and see if we can relieve pressure off the cord. But it's not an emergency. It's might not be something that we have to turn off the oxytocin for, because maybe changing the position or even giving her some more IV fluids might help with that first. And we want to give, continue the oxytocin if we can, if the baby's not in distress, because we're trying to get labor started, right? Okay. A laboring client complains of low back pain. The nurse replies, this pain occurs most when the position of the fetus is red, breech, blue, transverse, yellow, occiput anterior, green, occiput posterior.
Green.
Good. Yes. So she's experiencing back labor, right? Occiput posterior is not the optimal position for the baby to exit through the birth canal. And that is a very common reason for having back labor is the baby's occiput posterior. So what we would call sunny side up. It's like coming out face up instead of face down. And it's just hard to make those turns through the pelvis and puts a lot of pressure on her. Okay. Which assessment data can be determined by examining the fetal heart rate strip from the electronic fetal monitor? Oxygenation, red. Gender of the fetus, blue. Yellow, fetal position. Green, labor progress.
Red.
Yes. Oxygenation of the baby, right? We talked about that. In particular, the variability of the heart rate shows us the current oxygenation status. Okay, good. A multip client in labor states that she feels the urge to move her bowels. How should the nurse respond? Red, let the client get up to use the potty. Blue, perform a pelvic examination. Yellow, allow the client to use a bedpan. Green, check the fetal heart rate.
Blue.
Okay, good. Let's see if everybody got that. Okay, yeah, so the keys here, she's a multi-paris client, multip. I hope that didn't confuse anybody when I use kind of the abbreviated term for that. So what does multip mean? What is a multi-paris?
Multiple
Pregnancies.
And even more, so let's be specific just to help you on your test. It doesn't just mean multiple pregnancies, it means multiple something else.
multiple birth.
Yes, multiple births after what in particular? What's the definition of para? Anybody remember? You're going to want to know this when I'm sure you're going to have at least one question on the GTPAL,
Is it after 20 weeks?
Yes, after 20 weeks. And Marcia put 20 to 37 weeks, but it's actually anything after 20 weeks, not just stopping at 37 weeks. So she has had multiple deliveries of a baby after 20 weeks gestation. That means that road has been paved several times before, and she might move quickly from being just a few centimeters to being complete and pushing, needing to push the baby out. then she feels like she needs to have a bowel movement, we're not going to get her up because she might end up having the baby on the floor until we check her cervix. Okay. So we're going to check her cervix first if she's saying she needs to have a bowel movement. Okay. Fetal presentation refers to which of the following descriptions? Okay, presentation. Red, relationship of the presenting part to the maternal pelvis. Blue, relationship of the long axis of the fetus to the long axis of the mother. Yellow, fetal body part that enters the maternal pelvis first. Green, a classification according to the fetal part. This is kind of hard. So, fetal presentation is the fetal body part that enters the maternal pelvis first. So, the way I would remember that is when you see presentation, it might be, again, because I'm in this field, that it kind of comes to mind first, but a common question that a doctor or healthcare provider might ask, they might say, what is the presenting part? Okay, so the presenting part is the fetal presentation. The presenting part would either be, the head or the butt or the shoulder or the brow. So what is the presenting part? That is the presentation. The presentation then is either vertex, breech, right? And so forth. Okay. So the presentation, what is the presenting part? So the fetal body part that enters the maternal pelvis first. All right. Just review all those terms that you probably went over in class. I know we did, to kind of make sure that you understand a little bit of the difference. Hopefully the questions won't intentionally trip you up, but I would review those definitions. The nurse realizes that the most common and potentially harmful maternal complication of epidural anesthesia would be red, severe postpartum headache, blue, increase in respiratory rate, yellow, limited perception of bladder fullness, green, hypotension.
Green.
Yes, good. All right, good job. Yeah. So a couple of those could be side effects of epidural, but it's not the most common or most severe, potentially harmful, right? Hypotension, what happens? Why is this potentially harmful if the mom gets hypotensive following an epidural procedure? What happens? Anybody know? You want me to tell you? You just knew that it was, but didn't know why? Marcia says, I missed the question, but tell us. Hypotension, very common after epidural procedure, and it's a very urgent matter to attend to, because maternal blood pressure dropping, it shunts all of her blood to her vital organs, and the placenta is not one of her vital organs. So it stops receiving as much or sometimes any blood supply. So we see very, very quickly late decelerations in the baby's heart rate. And we start to see, that the baby is struggling based on its fetal heart rate tracing. So we don't want to leave the mom hypotensive. We want to support her blood pressure with medications like ephedrine if we need to. But first line is usually LR, IV fluids. So we pump a lot of IV fluids right before the procedure. And if needed, if her blood pressure still begins to drop, we're going to give her even more IV fluids after that, as long as she's not fluid restricted. So, hypotension is most common and most potentially harmful side effect of an epidural procedure, okay, because of the way it affects the baby. The nurse accurately tells the client that fetal circulation consists of red, 2 umbilical veins and 1 umbilical artery. Blue, arteries carrying oxygenated blood to the fetus. Yellow, 2 umbilical arteries and 1 umbilical vein. Or green, veins carrying deoxygenated blood to the fetus. All right, good job, y'all. You may know the acronym AVA to remember. You can name the umbilical cord AVA to remember how many arteries and veins are in there. And you can remember that circulation to the placenta is backwards, right? From normally in adults, our arteries carry oxygenated blood, but going from the baby to the placenta, the arteries carry deoxygenated blood because it's going away from the heart to the placenta to get oxygen to bring back to the baby. Okay. So good. Another just note on kind of test taking skills with this question, you know, you can kind of rule things out. Even if you don't really know the answer, you can figure that it's, you know, if it's either going to be red or yellow or blue or green, but, you know, then you're kind of narrowing it down. And if you read blue and green, they're basically saying the same thing, right? That arteries carry oxygenated blood, veins carry deoxygenated blood. So if they both said oxygenated, then you would know that one of those was correct and you could rule out all the rest. But since they both say the same thing, then you would know that neither one of those is the answer, right? Hopefully that made sense to you, but just to be able to start ruling out choices on your test sometimes just based on looking at the answer choices. The nurse determines that the fetal heart rate is normal if which of the following is noted? Red, 80 beats per minute. Blue, 150 beats per minute. Yellow, 100 beats per minute. Green, 170 beats per minute. We kind of reviewed this already. So a normal fetal heart rate. Good, 150 beats per minute. The physician has documented the presence of Goodell's sign. The nurse determines this sign indicates red, softening of the cervix. Blue, the presence of HCG in the urine. Yellow, a soft blowing sound that corresponds to the maternal pulse. Or green, the presence of fetal movement.
Red.
Good. I can't remember if there are a couple more questions about the signs of pregnancy in this little quiz, but make sure that you review the presumptive and probable and positive signs of pregnancy again, okay? For some reason, they seem to, you know, test makers seem to like for you to be able to classify signs. Same with like the powers of pregnancy. Just kind of review those acronyms and make sure you understand those classifications. We can see what other questions there are here and talk about them briefly too before we go if you want. All right. Which of the following statements, if made by the student, indicates an understanding of the term quickening? Red, it is irregular, painless contractions that occur through pregnancy. Blue, it is the fetal movement that is felt by the mother. Yellow, it's a blowing sound that can be heard when the uterus is auscultated. Green, it is the thinning of the lower uterine segment. And Latoya says blue. So good, yes. Quickening, fetal movement felt by the mother, sometimes easily confused with the term lightening, which is engagement, the baby dropping into the pelvis. Okay. Which of the following signs indicates a probable sign of pregnancy? Select all that apply. Red, uterine enlargement. Blue, Braxton Hicks contractions. Yellow, Chadwick's sign. Green, outline of the fetus via radiography or ultrasound.
Blue, red, and yellow.
Okay. Good. That's what, was that Deborah that said out loud and Latoya is
Yes.
texting? Okay.
Yeah, that was me.
Yeah. So Latoya has typed the same thing, and yeah, so everybody got it right. Good job. Sounds like you've already reviewed those and understand those really well. So good job. A client at 36 weeks complains of discomfort with irregularly occurring contractions. The nurse instructs the client to: red, lie down until they stop; blue, time the contractions for 30 minutes; yellow, walk around until they subside; green, take 1,000 milligrams of aspirin for the discomfort.
Yellow.
Okay. Latoya said yellow too. Okay. So in false labor, walking around usually helps contractions go away. If she were walking around, and they started to get more frequent or intense, then she would need to go into the hospital to be assessed for that. But I don't think that blue is a bad suggestion at all. I would recommend that she times contractions for 30 minutes. So I think the key here is that the contractions are irregular, so you can predict already that they are probably false labor contractions, and that walking might help. So that's probably why this is the choice here. I would also, if it were an option, I would choose to tell her to rehydrate, to drink a lot of water, because dehydration is also a big reason a lot of times that somebody might be contracting more than usual. Can cause contractions if you're dehydrated. Okay. Just a couple more here. Which of the following answers best describes the stage of pregnancy in which maternal and fetal blood are exchanged? Maternal and fetal blood exchanged. Red, conception; blue, 32 to 34 weeks gestation; yellow, 9 weeks gestation when the fetal heart is well developed; or green, maternal and fetal blood are never exchanged.
Green.
Yes, never, never land. That's funny. Yeah, good job. Exactly. You never want them to exchange, because they could be, and often are, different blood types. And that can cause problems for either the mom or the baby, right? Or both. Gravida refers to which of the following descriptions? Red, a serious pregnancy; blue, number of children a female has delivered; yellow, number of times a female has been pregnant; green, number of term pregnancies a female has had.
Yellow.
Yes, good job. So it sounds like you've reviewed those terms as well. So good. All right. And that is the end of that review Kahoot. I wanted to pull up. So good job, guys. I'm not gonna do that too much because they I know it's not a good reflection of what was happening here. Okay, so hopefully all of you are familiar now with your resource repository, where you have access to a lot of review materials and things. So as you know, weeks 1, 2, and 3 are what are covered here, and each one has questions that you can kind of ask yourself and make sure that you know the answer. Find the answer in the book. If not, there's some review like games and things here too. All of these arrows open up and you can find more information. Other videos and things that you have probably seen a lot of already. And then for your exam prep, These are mini lectures, so if you want to review like a particular topic, you know, us as instructors, we've recorded and posted little mini lectures on some of the major concepts on the test. And then we each have a review that's posted here too. So similar to the review that we just did, you can see the other instructors' reviews, and they're all YouTube links, which I think is nice because you can watch them like double time, you know, and just pause it and kind of you know, quiz yourself. So I encourage you to keep using those this week until your test. When are all the rest of y'all testing this week?
I test on Wednesday.
Wednesday? Okay.
Wednesday, same thing, Wednesday.
Tomorrow.
Tomorrow. Okay. Yeah. So some of you still have kind of a little time to review, but maybe in the morning at least. And I know most of you are taking other courses too, so it's trying to balance all of that. But just try to review. If you haven't seen, there is a blueprint here. It doesn't give you a ton of detailed information, but it can at least, if you haven't seen that, I'll just open it up. But it kind of can try to at least focus things a little bit for you for your studying. This is, so the green is exam 1, blue is exam 2, and the yellow or whatever is exam 3. And Marcia said, can you show us where to find the practice exam before we end Zoom? It is on Exemplify, yes. So exam soft, let's see. And it does say duplicate, yes. Yeah, so the duplicate is the one that I shared. We have to duplicate the exams. Your regular exam will say duplicate too, probably, because we have to duplicate them and then make our like edits or whatever. So we don't edit the original exam. But yeah, good question. It sounds like you've already got it covered, so I won't pull it up. But if y'all have any questions, of course, reach out to any, you know, you can feel free to reach out to me, but your instructors, all of us are here for you. So anybody have any other questions or anything that you want to touch on? I'll stop sharing here so you can see each other. It sounds like you're well prepared, so you know, props to you. For math, anywhere online to point us to a nice math review? Good question. Again, it can be kind of tricky to do that, but we have math resources here. Let me go back and show you. All these, wherever you click in the repository, if you go to the top under quick links, there are things that are just extra helps for you. Okay, so math help is one of them, OB meds is one of them, APA and so forth. So if you click on math help, all of these are really good kind of recommended you know, methods for solving the problems, and you can even kind of do the practice problems. Yeah, of course, you're welcome. So hopefully that'll be kind of a good a good starting point for you, at least. Some videos here, and then this one is actually Dean Brown, the online dean, that recorded something for you too. So yeah, that's a really good place to start if you're kind of struggling with some of the math. I'd recommend that. Anybody else? If not, that is the end of this review, and it's been exactly an hour. So thanks for joining and participating, and good luck this week on your tests for all of you. And again, please reach out if you need anything.
Thank you.
Thank you. Have a good night.
Thank you. Bye.
Too.
You're welcome.